I'm Steve Carlson from Minnesota. Everywhere I turn, I see Amy Klobuchar or Tina Smith or Keith Ellison claiming they are going to protect pre-existing conditions. But Trump is not, Republicans are not. Have you seen this stuff? Well, let me tell you about my experience with pre-existing conditions and your experience. I am a person affected by breast cancer because my beautiful little wife has it, and so she is in treatment. And my work with the American Cancer Society has saved her life. And guess what? We are suing Minnesota, suing Emily Johnson Piper, the attorney for Governor Mark Dayton, and his commissioner of the Department of Human Services, because they won't protect my wife from that pre-existing condition, breast cancer. Well, how can this be? The establishment and progressive party of the women Amy Klobuchar and Tina Smith won't protect you against breast cancer. Just last week, we learned and are grateful that the cancer doctor, the oncologist, is going to treat her for 2 more years, for a total of over 7 years. And so Lori Swanson won't be able to argue that our case is moot on the grounds that my wife is no longer a cancer patient deserving of treatment under the Medical Assistance Breast and Cervical Cancer Federal and State Program, MABC. That's what these establishment and progressive Democrats wanted to do. Say, well, oops, we have failed and refused to continue your cancer treatment for over 2 years. So sorry, but it's over because we stalled in administrative hearings and quote-unquote judicial review, but we ran out the clock while your treatment ended, and we won because your treatment is over, and you don't deserve to receive your benefits while your case is on appeal because you can no longer claim an entitlement to have your cancer treated because it is finished with or without our help. Well, because the original tumor was high grade, a 3 on a scale of 3, the doctor correctly decided that to reduce the risk of a return, a relapse, to an acceptable level, she must continue hormone therapy. She'll need to be treated through the age of 69 and remains entitled to the categorical Medicaid program for cancer care that she's been accepted in through that time. But, oh, says Emily Piper, Mark Dayton, and Lori Swanson, we don't protect you from this pre-existing condition when you're 64 years old. We try to get you on Medicare and off your cancer coverage when you're 63 years old, and we'll pull this dangerous stunt with no hearing and no contact, and there's not a darn thing you can do about it because you made the mistake of believing the government fooled you there and trusting Barack Obama, Hillary Clinton, and the whole crew with your health care. Well, here's a nice cliff. Why don't we throw you off? So if you think about it, what does it even mean to cover or protect pre-existing conditions? That wonderful promise you hear everywhere you turn. Amy Klobuchar promises. It means nothing. Oh, I know supposedly you can't be turned down from coverage because you have breast cancer. In our case, we have to find insurance to pay for breast cancer treatment, which has been going on for 5 years and will continue for 2 more. This uses a medication called anastrozole or Arimidex and has enabled her to survive for 5 years, to fight like a girl, even though she'll be 67 now. I'm fighting like a girl with her and with the help of God, but not with the help of Amy Klobuchar, Tina Smith, Mark Dayton, Keith Ellison, or Lori Swanson. They think it's just fine that they betray my wife and hundreds of others just like her in cancer alone. We know some of these women are now deceased because of their treatment at the hands of these smiling politicians who want your vote. So I want to ask you, if this crew won't help women actually in treatment for breast cancer at their most vulnerable time, just who are they protecting against pre-existing conditions? Did you know that in Minnesota, the courts have ruled that if you're eligible for medical assistance and you want an abortion, you must be given that abortion and it must be paid for with taxpayer dollars through medical assistance because the Constitution. And if you want a so-called transgender operation to allow you as a man to be a woman, well, sure, because the Constitution, so you must be made into a woman with taxpayer dollars. taking money away from Granny in breast cancer treatment. Edward Leary, who raised the issue is whether our case is frivolous, actually ruled that transgender operations must be paid for by medical assistance. But breast cancer care already begun and promised with federal dollars. Well, we need those funds for other costs, for abortion, for transgender alteration and modification. And so we can't promise meaningful benefits for any public assistance. And that's what we meant to say when we said breast cancer treatment. And if they can't promise meaningful benefits for a cancer patient whose life already hangs in the balance, how can they promise to protect you or anybody from literally hundreds of pre-existing conditions and treat them effectively with treatments that in many cases haven't even been developed yet? And how can all those insured under unmodified Obamacare, because as Betty McCollum told me, he do care. Oh, he does. You can trust me on that one. All be protected against every pre-existing condition known to man or woman? The answer is they can't. They don't get protected. We need to go back to the drawing board. We need a Plan B. And I have always argued that Plan B is for the federal government, HHS, CMS, Centers for Medicare and Medical Services, together with private effort like Susan G. Komen Race for the Cure, which funds breast cancer treatment, to target breast cancer under the National Breast and Cervical Cancer Early Detection Program and Breast and Cervical Cancer Prevention and Treatment Act, and to help those women with treatment, even at the time that their Medicare kicks in and pays 80%, greatly reducing the Medicaid burden to provide meaningful benefits to the completion of treatment. We need to extend that treatment even to women who are 65 at the time they are diagnosed with the cancer, because under current law, Senator Klobuchar, these women are excluded from the program. And we need to also fashion protection against other forms of cancer and killer diseases. And we need to eliminate the health disparities that affect Mexican Americans, Black Americans, low-income women, and other groups who are impacted disproportionately with higher incidence of killer diseases and higher mortality. But this targeted effort requires leadership. And as your next U.S. Senator, I promise I will provide that leadership. I won't just repeal Obamacare, I'll replace it. I'll work with Donald Trump and vote for a bill that replaces Obamacare with something that works. And when America does that, I will report to you as we truly protect Americans against one pre-existing condition after the other. And we will win. And when we make promises like protecting against pre-existing conditions, we need to keep them. And not just pretend we do when we really don't. When we really just try to commandeer the health insurance of average Americans who just want health insurance and don't want or can't afford to be the savior of every known disease on the planet before they can get a simple physical. We need to continue the dialogue, a meaningful dialogue with meaningful benefits that truly protect. We need more doctors and nurses trained right here in America. Do you have any idea what this massive and irresponsible spending program of Obamacare is going to have on the American economy and on the American dream of health care in the constellation of American liberty we all cherish, and the loved ones we do cherish? So we need to do this right now. We need to be honest. Pregnancy is not a pre-existing condition. That needs to be handled differently, with love and respect for human life. That is no reason to throw Granny or anybody else off the cliff with a dangerous government healthcare program. We need wisdom. We need to love our seniors and not abandon them, not break promises. Barack Obama and his Obamacare promised only to cut benefits because he couldn't bend the cost curve. And spoiler alert, he can't bend the cost curve. And he's cutting benefits. He promised to veto any bill that wouldn't cut Medicare by 1/3 to fund his scheme. But we can overturn this disaster. If America could put a man on the moon, and we did put a man on the moon in 1969, then we can shoot for truly protecting our people against pre-existing conditions. That we have not yet done, but we can. I'm Steve Carlson. I'm asking you to write me in for your next U.S. Senator replacing Amy Klobuchar, a woman who never did protect other women against breast cancer or any other pre-existing condition. And I approve this message. Vote November 6th and keep the promise to fight breast cancer.